Dr. Ifedayo Adetifa, the Director General of the Nigerian Center for Disease Control (NCDC), in his visit to the Lagos University Hospital LUTH, stated that it is important they continue to partner and collaborate with the institution because of the key role they played in terms of emergency preparedness and response, noting that they are just a group and not the frontliner. The Chief Medical Director, Professor Chris Bode, in his speech reminded him of what Dr. Chikwe Ekweazu promised they would do for the institution, which were the provision of the proposed 40-bed LUTH Isolation Center. A part of the isolation centers being constructed by the agency is still on the drawing board. Answering to the question, Dr. Adetifa gave an update on the long-awaited treatment center.
LUTH was peculiar. The treatment center that needed to be built is bigger and it's multi-storied, which is different from the templates that has been applied in other places. And that meant that sort of several additional layers of approvals were required. But as of today, I can confirm to you that using the World Bank funding that it's under our custody, we have already received World Bank approval to initiate the process of constructing this 3-story treatment center in LUTH. So we at the moment, the terms of references for all of the requirements that are required to begin the process have been submitted to the World Bank, and these include construction, health, and safety management plans, because obviously the design is different, the space is different, and a bit more due diligence is required. Of course, structural drawings, designs, and bill of quantities, and the firm to handle all of that, to supervise all of that, have been put together, and we are just waiting now for the World Bank to also approve that so that we can move on to the next level.
Further addressing journalists on monkeypox, Dr. Adetifa gave an update on the spread of the disease.
As at the end of as at the 19th of June, which is the 24th EPI week for 2022, we had a total of 41 confirmed monkeypox cases out of a total of 162 suspected cases. So that's the figure for the year. And I hope that clarifies. And well, to add, unfortunately, we did have one death, 40-year-old male organ transplant recipient who was on immunosuppressive treatment. And we do know that there's an association between increased severity of monkeypox and the increased risk of death in people who have immunosuppressive conditions.
However, Dr. Ifedayo Adetifa further addressed journalists that the traveling protocol of COVID-19 have not changed since the last time they were updated by the Presidential Steering Committee. He further stated that once fully vaccinated, all one needs to do is to complete the information travel portal, provide evidence of vaccination.